Welcome back, and you hopefully have done a little bit of research on spinal injuries and on the modified recovery position. Now I'm going to talk to you about the effects of heat and cold. Children in particular are far more susceptible than adults to even the slightest increases of heat or reduction in temperature. So you've really got three levels of uh, um, effects of hot and cold, and that's heat exhaustion, heat stroke, which is obviously excessive heat, and hypothermia, which is a lack of body warmth. So your normal body temperature sits at around 37 degrees, 37.5, something like that. Children, as you know, can have bigger spikes, but in the main, an increase or decrease of even 2 degrees Celsius either way can cause serious problems. Now, I am aware of children can go to 39.5. My kids have done it. My kids do it. 40. It goes above 40. We've got issues. Got to get them cooled down. But for most people, that 2 degree increase either way could signify a problem. Yeah. So there we are. Temperature's gone up. That would be for somebody who's maybe out and about, maybe doing some exercise in the heat. They've no took a drink, that sort of thing. They've obviously got physical activity going as well, so it's a compounding effect. But as working in childcare, you would know that a child can go to 39 and 40, and it's a problem, but it can be managed if you can get the temperature down. And depending on your rules, there is things that can help, like medication, Calpol and things like that. But for somebody who's out and about and maybe doing some exercise, that's not the same sort of thing. Heat stroke is far more severe. It's life-threatening. There is no question about that. And that's when the temperature goes above 40. 40 in an adult is a serious situation. And you need to get that body temperature down as quickly as possible. Right, here we are now dropping down a couple of degrees, just below 35. And that's what's called mild hypothermia. If you're mildly hypothermic, you're going to know about it. Your core body temperature will drop down those 2 degrees, and it's not very pleasant at all. We're now getting down to life-threatening, yeah, seriously life-threatening, severe hypothermia. If it gets down to that, you're in real trouble. Absolutely real trouble. That's something we need to think about treatment-wise, because that's not a straightforward treatment, and we'll talk about that. So, they're going to be confused. There's going to be dizziness if there's heat exhaustion, experience nausea, and they'll start to show signs of shock. Yeah, pale, clammy, that sort of thing. And they'll complain of a headache because they're dehydrated. Cramping up as well is a common problem. Sweating because the body's trying to cool them down. So, what we're going to do, very much common sense. Get them out of the environment. If they're out and about, get them in the shade. Loosen the clothing. Get some fluids into them. Yeah, just sips. Keep sipping, keep that water going. Just anything that's going to start to get that temperature down. Depending on how severe it is, if it doesn't sort itself out, you should consider medical attention. But again, that's very much down to the situation. Okay, we're way up again now. It's now becoming very serious. Yeah, very confused and restless. Now the body stops sweating. There's not enough fluid, so it's stopped doing its normal response to try and protect the body from heat. The brain's starting to heat up, and that's now causing problems. There's a chance of seizures because the brain is under a lot of stress at that point. It's not got enough fluid in its system, and strangely enough, there could be vomiting as well. So, again, move to the cool environment. It's definitely a medical emergency. If that person's unconscious or unable to communicate with you, it's 999. Now, rapid cooling in this situation could be something like, let's get a sponge, a towel, soaking towel, remove the clothing, put that wet towel on them. Yeah, it could be a sponge. You sponge them rapidly. If it is severe, then it could be a matter of saying, let's use a hose, or let's get a shower head and let's put them in there and start cooling them down like that. Yeah, we're not talking about ice baths and stuff like that. We don't have any time, but we want to cool them down as quickly as possible. There's not enough time to do things gradually. Yeah, that's absolutely the best thing. If you've got a wet towel and just lay them on that, top and bottom, you'd monitor, but the temperature can come down quite quickly. Yeah, because it's cooling the blood on the surface. And just get them down to that temperature. Monitor it, because what you don't want to do is to cool them too much, especially for little ones. Yeah, that's really, really important. It is possible to try and cool them, and you go too far. Right, so we're now on to the effects of cold. There's your normal body temperature, and it's now gone down a couple of degrees. And they're severe. Yeah, that's life-threatening. So they're going to have pale skin, and they're going to be cold. Shivering typically goes. Yeah, once the shivering stops, that's when there's a problem, because the body's own natural mechanism to create heat has stopped working. Slurred speech, slowness of movement. If you've ever been cold, say you've been, cars broken down or something like that, or if you've been out on a walk for a long, long time, or you've been in the water longer than you should have been, you'll know you can start to feel the early signs of hypothermia. And they're not quite with it. Severe hypothermia, you'll get nothing out of that person. They want to be able to cohesively have a conversation with you. And unconsciousness, once that's happened, they're in a serious situation. Obviously, we don't want to move them. Yeah, you want to keep them. You don't want to be sort of pulling them around, because their body's in a very fragile state. The heart's being stressed. Remove anything wet. Yeah, and get layers on them, because the layers trap the air in between and they warm up quite quickly. Yeah. Insulate from the ground. I mean, really, the wind and the outside conditions, that contributes hugely to the temperature in the air. So even if you can get them out of the wind, out of the conditions, get some dry clothes on them, make sure that they're not on the ground, because the ground will suck away the body heat very, very quickly, even if it's dry. And if they are conscious and cohesive, you would give them not hot, but a warm drink to help warm the body up slowly. If they are shivering and it's not that severe, it is possible to give them a bath. However, if they're very cold, we don't do that sort of stuff. If they're really, really cold, you need to bring them up gradually. It's much better to bring them up slowly. Right, we're going to get on to poisoning. It's unfortunately an extremely common occurrence. It happens mostly at home, and the last time I checked, I think it's around about 8,000 hospital admissions a year through poisoning. Poisoning as well is a common problem with children, because they're not mature enough to then realise that certain substances are highly dangerous. They confuse them for drinks. And it is a problem. I know that within an early years setting or a school, there's going to be measures to protect, to make sure the children don't go into areas which have got bottles and stuff like that. It's just been very vigilant. So, ways that it can enter the body. Obviously, it can be eaten or drunk. It could be breathed in if it was an aerosol or a gas or something like that. It can be absorbed through the skin, and it can be injected if it was the wrong medication. So for a corrosive poison, something that's going to actually burn, yeah, wash it away or dilute it. If we thought it was corrosive, there's a child having some milk, which will hopefully try to weaken the concentration of whatever that person's taken, and activate the emergency services. We obviously don't want that that substance, if it's corrosive, coming back up without medical care. and we just check the airway and breathing. Basically, if you activate the emergency services, they will give you guidance. If you tell them what's going on, they will give you first aid guidance anyway, because as you can imagine, there's so many poisons, so many chemicals, it's very difficult to determine exactly what to do. If they go unconscious, it's a recovery position. Yeah, we don't really want to induce vomiting. It's just got too many risks attached to it. It can burn the airway on the way back up. It can burn the esophagus, which is the food pipe. Also as well, it could cause breathing problems, and that's not what we really want. Okay, if it's non-corrosive poison, something like medication or something like that, we would just follow the guidance of activating emergency services and following the guidance in the COSH guidance, control of substances hazardous to health. You want to go back to that and look for that on the internet, that will show you. And again, monitoring the airway and breathing. Okay guys, it's time for you to do a little bit of work now instead of listening to me rattling on. We're going to do a little bit of research now. I want you to go online and start looking through two subjects that you're going to work on over the next 10 minutes. So what you might want to do is just make a note. You're going to be researching drowning and near drowning, yeah, or called secondary drowning. It's a very interesting subject that sometimes somebody who's had a near miss in the water can actually get a secondary effect, and they can unfortunately die from that. So as I say, make a note. You're going to be looking at this in your own time and do some research on drowning and secondary drowning. And also what you're going to look at is bites and stings. Yeah, a lot of misconceptions about treatment you can do if a child or even an adult gets a bee or a wasp sting or another sort of bite. But really, the thing you need to look out for is also a potential allergic reaction. So as I say, make a note of these two. Go get yourself a cup of tea or a drink. Do a bit of research to that, and when I come back, we're going to look at sickle cell anemia. Okay, for this section now, you should have researched bites and stings, bee stings and wasp stings, and also drowning, treatment of drowning, and also the concept or idea of secondary drowning, which is something that maybe a lot of people are not aware of. So you should be pretty up to speed on that. We're now going to look at sickle cell disease. Recognition, well, it's as it says, it's disease of the blood. The red blood cells, mutate. They create a certain shape that you can see there, and that causes problems. Yeah, they start to form clumps, if you like, clots, if you like. So the tissues are starved of oxygen, and it can cause severe pain and stiffening of the arms and the body, and it can swell in the feet and the hands. In severe cases, if it's not been treated, then it could show signs of a stroke. So what could set it off if they've got the medical condition? If they've got dehydrated, they're thirsty, so basically the blood's thickened. If they're not eating right, if they're not eating properly. If they allow themselves to get too cold, again it's putting a strain on the blood. Or if they become overtired or stressed. Most people who have got this have had some kind of diagnosis. It's not an undiagnosed condition. And also there's a chance of infection. Again, it's something that a lot of the trainers have not come across. I've not come across it, but you might have in your environment. And again, if it's this subject specific to you, then you need to look into this in more depth. So you'll be looking at the child's care plan, because as again it should be pre-diagnosed anyway, and if you can't contact the parents and there's a basic medical situation of breathing and circulation, it's a first aid incident. You need to get looking at the emergency services if you've not got contact with the parents. Always the fall back on is, as a person working in a school or working in an early year setting, you're not a medical professional. You have been given guidance and some training on how to identify a situation which would allow you to give a short period of care until professional assistance arrives. So, please remember that. If in doubt, you activate the emergency services, because it's it's a very difficult subject if someone becomes unwell. Just trust your judgment and trust your instinct. If things didn't feel right, then you do what the best thing feels like to do at the time. Just by observing the child, you will make the right decision. Meningitis. Right, the meningitis, we've got a video for that. So what I'd like you to do is, I'd like you to stop now and go on to the meningitis video. I mean, you've done that. We're going to come back and do a recap. Okay, well, that's pretty much it from me and my part within the online section. What's important about the resources that we've gave to you online is it's just really important that you understand that, yeah, I've spoke about a few subjects, you've got your reference manual to look to, and I've also got some videos that you've looked through as well, and I've sent you off to do a little bit of research. But that's the thing to remember, because of the modern technology now, it's fantastic. You can think of any question in the world, type it into Google, and you'll get a lot of information. But just remember, it's very common as well to get information overload, and if you've got a specific concern or need about something, or a specific child that's got a condition, you can get information overload. That's the thing to try and avoid. We have got some assessment papers for you, which are attached as PDFs, and really have a go through them, see how you get on. They will relate to the types of questions you will be asked when you go to your practical session. Now, when you go to your practical session, some of the things that we've spoke about will not be discussed because it's pure theoretical, lecture style, which I've done here. But the practical sessions, you're going to be how to deal with the incident, how to deal with a patient that's unconscious. You do the recovery position. You're going to do how to do resuscitation for children and babies. You're also going to be doing how to dress a wound, and how to move the patient around, be it a recovery position or a modified recovery position. You are going to get a chance to ask questions at the beginning and at the end, but hopefully everything you've done now has put you into really good standing so that when you go to your practical session, you're ready to go. Well, thanks for listening to me and getting through it. Hopefully it was interesting enough doing this, and it wasn't too much of your time. And I may see you on some of the training courses, but good luck with your practical session, and I'm sure it'll go well for you. But bye for now.